Hi, everyone. My name is Beth Quicker. I'm at Georgetown, and welcome to the Center of Excellence for Infant and Early Childhood Mental Health Consultation Conference, Equity from the Start. I will be your session moderator, and I'm joined by Anne, who will be serving as our technical host. And as you can see, you are here at the session for consultation as a support for children in foster care. And this is being recorded. The handouts link has been put in the chat box if you're interested in downloading those. Please feel free to put questions in the chat box and I'll keep an eye on those. I'll generally, I think, try to save those towards the end of the session, but might bring up anything that's germane in the moment if it seems appropriate, but go ahead and put down any questions as we go along. And I'm going to let our presenter, Nikki Edge, introduce herself and get started. Thank you, Nikki.
Thanks. Good afternoon. I appreciate all of you being here in your after lunch hours. Good to see you all. I'm Nikki Edge. I am at the University of Arkansas for Medical Sciences in the Department of Family and Preventive Medicine. I do a lot of research in early childhood mental health, and one of the favorite things that I get to do is provide oversight for our state's infant and early childhood mental health consultation program called Project Play. This is probably the last time you'll hear me say infant and early childhood mental health consultation, because that could take up 30 of my 50 minutes of this presentation. So I'll just say consultation probably from here on out, and you'll know what I mean. All right, so we're just gonna dive right in here. I wanted to figure out a little bit about who is with us today. So we just have a poll to find out which among you are currently providing or supervising in some way involved with a consultation program currently. And for those of you for whom the answer is no, maybe you can also just drop us a note in the chat and let us know about your current profession or role, so we have some sense of who is here with us today. And I'm seeing the answers pop up here, and it's looking like about 60% of you are currently providing or supervising consultation services. Give you just a little bit longer to get your answer in there, and then maybe just drop us some notes in the chat about your role.
Yeah, we have some early Head Start home visitors. I saw occupational health, occupational therapist, early childhood, special ed, Head Start director,
Great.
Social worker.
Great. Well, some of the things that we're going to talk about today are a little bit nitty gritty about consultation itself, but there should be hopefully something in here for you regardless of your role in this world of early childhood. So thanks for letting us know who you are. Think.
Also lots of early intervention. Looks like
early intervention, right? So, yeah. Great. And Anne, can you just share the results of that poll real quick? Or?
Sure. There you go. 58% yes, 42% no. We had about 156 answer, and we have many people putting in the chat.
Great. Great. All right. Well, with that, now that we know a little bit about who you are, we can dive right in. So what we're going to talk about today is I'm just going to start with a little bit about the need and the opportunity for using consultation services to support children in foster care. I'll talk about some of what we've tried to do with our program here in Arkansas, how we've seen that work. And then some of the lessons that we have learned about making consultation more effective when we're serving children in foster care. So that's a lot to cover in this short time together. So as we start to think about the need for consultation services to support children in foster care, I first want to define a few of the challenges that children in foster care sometimes experience in trying to access high quality early care and education, and in trying to find stability in early care and education. So I'd like you guys to just drop into the chat some of what you've seen wherever you live and work in your own community. What are some of the barriers that you have seen existing for children in foster care and trying to access high quality or stable early care and education? I know many of you have probably worked around children in foster care and may have some of those experiences to draw on.
So I'm just going to read out some as I see them: not understanding trauma responses, transient family, resources such as transportation, unstable environment, unstable placement, access to counseling, frequent foster home moves, rural community, rural resource issues, lack of understanding of trauma, lack of foster families to take kids. They're coming fast and furious.
Yeah.
Seeing a lot of trauma.
Yeah.
Right.
Thank you.
Mm-hmm.
Yeah, thanks, Beth. So that sounds like my community is not very different from your community, and we're having a lot of kind of shared experiences and seeing a lot of the same things. I want to tell you a little bit of our story in Arkansas and some of the data that we have gathered over the years, quantitative and qualitative, that have tried, as we've tried to wrap our heads around this issue. So, as you guys have alluded to, we want children in foster care to be in places that understand what they've experienced and that understand their need for having stable relationships with caring adults, given that their relationships have been disrupted. And we know that high quality early care and education can be a buffer, can be a support to kids who have had difficult experiences. And we know the opposite is true, that for children who've already had their early relationships disrupted, if those disruptions continue in their early care and education setting, or if there aren't nurturing relationships in those settings, then their development can be even further compromised. So besides the work that I do, which sometimes intersects with child welfare, for years I served as a volunteer court-appointed special advocate, a CASA, in the child welfare system. And I always made a point to visit the child care program of the children in foster care that I was responsible for. And this was back about 10 years or 12 years ago. I had a series of, to be honest, deeply disturbing observations in early care and education settings, where the children that I was observing that were in foster care barely had their physical needs met, and clearly their needs for emotional safety were not being met in the early care and education programs that they were in. So being that our consultation work is funded by our state DHS Division of Child Care, I went to our funder and I said, is this just my experience? What do we know about this? Can we look at this? And they said, yes, we can look at this, but quality is just one of the issues. We've just been having recent conversations internally about stability. We had one of our program specialists come tell us the other day that she moved one child in foster care's voucher to 5 different programs in 1 week.
Babe.
And so we began to decide to look at the data together and see if what we were experiencing was just, an aberration, or was this a pervasive pattern for children in foster care in our state. And unfortunately, what we found out is that it was a pervasive pattern. So we had 71% of children in foster care in non-quality rated programs, not even the lowest level of quality, just programs that were not participating in the quality rating system at all. I thought, oh, well, maybe a bunch of them are in early Head Start or Head Start, which is one of the places we would definitely want them to be to get great, comprehensive, high quality care. And of the thousands of children in foster care in the state, less than 100 of them were in early Head Start or Head Start. Thankfully, that picture has dramatically changed today, but it definitely sparked our concern. We also gathered qualitative data from about 50 early care and education program directors who had children in foster care naturally clustering in their program. So the programs that serve 20, 30 kids in foster care. And they told us about their concerns. They told us about frequent moves, that often the children in foster care were kind of transient, would kind of be there one day and would kind of literally, they just called it disappearing on them. They were just not there the next and no one knew quite what had happened. They talked about disruptions to daily routines like visitation and court visits that are during nap time, during lunchtime, kind of disruptive to the child's day. They talked a lot about communication challenges. And what we kind of came to learn from our interviews with early care and education program directors was that there was a lot of misperception about sort of the confidentiality issues which do surround child welfare. And they thought, I can't ask. I'm not allowed to even ask, which, you know, we're able to help them learn is not actually true, that they can know information about a child in foster care. They can engage with the caseworker. So that was one of the things that we wanted to tackle. And these program directors were very candid about the need for training and support for their teachers, the way that you guys have identified. They said our teachers want to know more about how to support children with experiences of trauma. So, you know, as we were coming to, you know, grapple with these issues and the needs of children in foster care, we recognize too that this is disproportionately impacting children of color. We know that inequities exist both in the child welfare system and in the early care and education system. So we know that children of color, especially Black children, are disproportionately involved in child welfare. There's disparities that surround their progression through that system. For example, they are more likely than white children to be removed from their home. And similarly, we know that children of color are disproportionately likely to experience punitive discipline in early care and education, to be excluded from early care and education through suspension and expulsion. So lots of complex issues that we wanted to try to think about, you know, what are we going to do about some of this with our little consultation program here in Arkansas? So that was really our challenge. So early in our history, we were a very small mental health consultation program. And our child welfare partners quickly told us, we cannot send you every child-focused consultation need we have, or we will swamp you in the first 5 minutes. So we got really strategic with our funder. And what we decided to do was to prioritize what we call classroom or programmatic consultation for just using the data for early care and education programs where children in foster care were naturally clustering. So these programs where 6, 10, 15, 30 children in foster care had just kind of naturally found their way to some early care and education program in their community. So if you aren't familiar with classroom consultation, I'll let you kind of read about it there. But really, it's the goal of this kind of consultation is to support teaching staff in building the types of relationships and classroom practices that are going to support all kids' social and emotional development, and that, of course, are really going to benefit some children who may need it the most. For example, kids who've had their relationships disrupted. And for us, we did that in the context of a 6-month partnership where we visit once a week. And again, these were primarily not quality rated programs. So we weren't sure kind of what their readiness for consultation would be or what outcomes we should expect, but I'll kind of touch on that in a moment. So we had several years of experience providing this type of programmatic consultation. And then kind of our state landscape changed. And in 2016, our state launched a statewide suspension and expulsion prevention system. And our consultation program became a part of that. And so we more than doubled in size to be able to support the need. And we also gained new partners, technical assistance providers around the state that we work very closely with. And so our state now has a tiered kind of expulsion prevention system. And one of the ways that we know a case needs to come to a mental health consultant rather than a technical assistance provider is if it's a child that has experienced significant trauma, if it's a child in foster care. So about 20% of the cases we serve are children in foster care. And you can see kind of there what our child-focused consultation services are all about. We have a very short-term model just because, frankly, there's not enough of us to go around. And so we kind of have to do what we can in a brief time and then have the ability to come back later if needed. So I'm going to kind of zoom ahead and tell you that, you know, again, we didn't know if this would work either. There's very few consultation programs that operate on this short a model, but thankfully for the goals that we had for expulsion prevention, it was effective. So this is just a slide to say, thank goodness it worked, right? You're always relieved when you get your evaluations reports and it says what you hoped it would say. So our early work in providing programmatic consultation, we were able to show significant improvements in the mental health climate in the classrooms that we were in. So we had research assistants that would go in and observe before and at the end of our consultation time together. And they were able to see significant improvements in the areas that you see on your screen there. And then similarly, we're able to show a positive impact in these child-focused cases. Again, mostly children that have experienced trauma, lots of children in foster care. And what you're seeing on your screen is just results from one of the questionnaires that we use, which is a form that teachers fill out. It's a standardized rating of children's emotions and behaviors. And the percentage that you see on your screen are the percentage of children who score as like clinically elevated, meaning their scores are high, they're atypical, it's an indication the child may need mental health supports in their lives. And so you can see that is most of the kids that we serve. These are children experiencing great challenges in their classroom, great challenges with emotions and behaviors. And thankfully, in the green line, we do see improvements in just the first 3 months of service. So that's really the context for our work and the, you know, whatever that was, 12 or so years of experience kind of working on behalf of children in foster care. And so now, hopefully having convinced you that that was a worthwhile endeavor in Arkansas, I'll shift gears and tell you some of what we've learned about how to be more effective in the work that we're doing. And so one of the things, and again, some of these things I'm going to talk about are going to be basic for some of you seasoned consultants who've been doing this work for a long time, but some of you newer consultants, I hope that you find this helpful. And one of the most basic tips is that, you know, when a consultant is working, you get the paperwork on a child-focused request, and you see that this is a child in foster care. You know that they have had their relationships disrupted. You know they've experienced difficult things in their life. It can be easy to get tunnel vision. It can be easy to say, oh, this is about the child's trauma, and go in like with a kind of a case conceptualization already like laid out in your mind. And we learned it can be really important to guard against that you want to approach this with the open mind and looking at all the basics and doing all the information gathering that you would always do when someone says, hey, I think I may have a child-focused case. Certainly, it has not been unusual for us to walk into a situation and say, you know, I'm not ready to say this is a child-focused case yet. You know, I'm seeing, you know, lots of challenges around developmentally appropriate practice, or I'm seeing a high level of chaos in this classroom. And, you know, we may need to just look at the basics of the classroom first. And so that would be, you know, one of the things we've learned is don't get tunnel vision when you get these cases. Look at the physical environment, look at those developmentally appropriate practice, look at those schedules and routines, and don't feel too pushed to take it as a child-focused case if you're feeling like there are other options that would be better. And we're lucky in Arkansas that we also have technical assistance partners that can help with some of these things when we encounter them. Okay, one more basic nugget is, again, can be really important reminder for our newer consultants, is if you decide you're going to open a child-focused case involving a child in foster care, you've got to figure out who could legally provide consent. So children in foster care, the state is their legal guardian. Rules are different in different states and tribes and localities about who can give consent. Can a foster parent provide consent for your work? Does it need to be the caseworker? In Arkansas, it has to be the caseworker. And you guys, if you've ever worked around child welfare, you know that caseworkers are not able to sit at their desk monitoring their email to sign a consent form from you all day long. They're in the field, they're busy, they're stressed, they're in court. So what we have found works best is if you can identify a central contact in the child welfare system that is somebody who understands your work as a consultant and is willing to provide consent for that work from the state agency. Still important to make sure the caseworker knows about your work, understands your role, and is a partner with you, but at least you can get off the ground without waiting 2, 3, 4 weeks, to try to obtain consent from a very busy caseworker. So having that central state contact can be really helpful and important. Another key piece is figuring out who all is part of this child's caregiving world and who is going to be in your communication network as a consultant. Is there biological family that's visiting and involved and working toward reunification? What about the foster family? Is it moving to pre-adoption? Who's in your communication network? There's even important nuances like figuring out, are biological family members and foster family members working together in such a way that you might meet with them together at times. So the caseworker is going to help you really sort out who's in your network and how best to communicate, because this communication with family is obviously such a key part of consultation. So for those of you who have been doing this work for a while, you know that information gathering is like a huge part of the early weeks of opening a child-focused consultation case. That's always kind of the really important first step, is trying to get a picture of the child's world, what's happening in the classroom, what are the concerns, what are the issues. So there's an additional layer of that, though, in a case involving a child in foster care. And so I've wondered what you have found are important pieces of information that you need to gather specifically about the child's involvement with the child welfare system. What are the questions you're asking of the caseworker to try to inform your understanding of this child, their needs, this situation? Just drop that in the chat if you would.
How many placements they've previously had?
Great question.
Where they are in the process.
Mm-hmm.
Why was the child removed, or what led to removal? What are the reunification plans? Siblings? How involved is the bio family? What are the visitation parameters? How many caseworkers they've had? What do visits look like? Trauma history. Important people in their lives and the status of those relationships. If they're in any therapy of any sorts, what services are they already receiving? Have they been in early childhood programs? Extended family involvement, age of removal, is there an IEP in place? Health history.
Yep. Perfect. Y'all have got it. Experienced consultants, I'm preaching to the choir. So one thing that we have noticed in our consultation, as I'm sure you have noticed, is that early care and education program staff don't always have this information on children that they've served. They may not be in great communication with a caseworker. They may be getting like bits and pieces of information from a foster parent, for example, but they don't necessarily have the child's kind of whole story. And so one of the roles, that I think is really key for a consultant is to help kind of build that capacity in the teaching staff and in the administration to feel empowered to ask these kind of questions and to kind of help do that, kind of help them figure out how to navigate getting some of these answers. We know that if you don't get good information about the case, you're likely to show up to provide consultation one day and the child's not there. You find out they had court yesterday. You didn't even know there was court yesterday. You find out they transitioned back home and then they're gone, right? And so kind of knowing where is the where is the case in the child welfare system? When's the next court date? What are the options of what might happen at that court date? You know, all those things you were talking about are so critical. And then to do that in concert with the early care and education team so that they know next time they have a child in foster care, yeah, ask these questions. You know, these are appropriate questions to be asking. And so then again, I'm just going to keep preaching to the choir a little bit because you guys have already talked about some of this. So as you guys mentioned, it is not in the basic training of all early care and education providers to know very much about childhood trauma. Many do, some do not. You may notice in the way that they're describing a child to you, in the way that they're describing challenging behavior, that they haven't necessarily connected the dots between experiences of trauma and emotional or behavioral challenges that they're seeing in the classroom, because that connection was just not made in their prior training to date. And so having some information about childhood trauma and its impacts can be really helpful. It can help them understand some of the reasons for the strategies you might suggest. For example, maybe you're looking for stronger routines and a sense of predictability in the classroom. And if you can share a little bit about why that's important for children with experiences of trauma, that can be helpful. However, we have also observed that sometimes having information about trauma or even just knowing a child is in foster care can have unintended consequences. It could make a teacher feel a little hopeless about a situation, or like this situation is somehow out of her scope and role, that maybe there are different experts who could be more helpful here, or this is the realm of, you know, mental health professionals. Surely there's another program more equipped. It can leave teachers feeling sometimes a little overwhelmed. And so it's important to find that right balance of sharing information, but also making sure teachers are left feeling empowered about what they can do and not disempowered based on kind of overwhelming information about trauma. And so I wanted you guys to get in some breakout rooms and kind of discuss that tension and discuss what you have found works in your consultation practice, or whatever your professional role is as you work in Head Start or other places. So how have you shared information about childhood trauma and its impact with teachers in ways that has worked well? Or are there lessons learned from things that you've tried that didn't work as well as you wanted? So we're going to put you in some breakout rooms for about 8 minutes and let you guys kind of discuss that in some small groups. So how have you shared information about childhood trauma in ways that has worked well? Or what lessons have you learned?
And if you haven't had the experience of getting to do that yet, I guess hypothetically contribute by saying how you think you might want to do that, or how you would imagine doing that, or what would work for you.
Sounds great. Thank you. We'll see you back in 8 minutes.
Okay, you should flow through. It might give you the option to join a breakout room.
All right, we're seeing y'all all come back. We'll give people just a couple more minutes to rejoin the group. Great, I hope y'all had a rich discussion in your breakout sessions. We had some interesting conversation in the room that I was in. I'm not gonna spend much time debriefing so that we can kind of move on here in this last 15 minutes or so that we have together. Let me try to reshare my screen. Somebody give me a thumbs up if that worked.
That's looking good.
Great. I wanted to talk a little bit about support for staff in consultation cases involving children in foster care. I think that you know, many mental health professionals become very experienced early on in their careers, finding ways to leave work at work, finding ways to take care of themselves, finding ways to you know, not let some of the challenges travel home with them. And it's always a key role of consultants, I think, to support the well-being of early care and education staff. But it's also important to remember that many teachers may not have had some of those experiences that you had as a mental health professional, kind of worrying about kids, and we know that teachers sometimes feel kind of an extra emotional load working with children in foster care. We know that some of them may struggle to understand the mission of the child welfare system. They may not understand why certain families are being reunited. They may find themselves taking sides, sort of, in a case. They may worry for a child who's about to have a home transition. They may worry about children long after they've left their care. So it can, I think, be really emotionally burdensome for early care and education program staff who haven't had this experience before, or even if they had. There may be staff for whom working with a child in foster care reminds them of their own childhood experiences, reminds them of their own trauma. So there's kind of this layer that I think is always important to think about in this work. And it can be, I think, really important, this, the idea in the consultative stance of holding hope in challenging situations, and helping teachers remember all that they're able to do to support children and to support families. I'm going to skip over that one. So, we spent a few minutes talking about how it's not always in the training of early care and education professionals to understand about childhood trauma, but let's flip that and remember too that so often we need to educate our child welfare partners about early care and education, about quality, about stability, and kind of speak up and remind them that there are benefits to stability, that there are benefits to quality care, and what can the child welfare partners do to help maintain stability and quality during times of home transition, for example. So we're going to spend our last few minutes really talking about transitions. So we know that we really want kids to be able to stay in a stable early care and education setting when home life is changing. Very important to be able to do so. Not always possible. We know that too often children move childcare every time they move homes. Or within a child care program, they're moving classroom to classroom or teacher to teacher. So I wanted you to spend a few minutes in a breakout room, and I know we're short on time, so I don't know, Anne, if it's possible to reduce the time on the breakout room to about 6 minutes.
Sure.
If that's possible, great. I wanted you guys to spend a few minutes talking about elements of a transition plan that have worked well in your experience as a early care and education provider or as a consultant. What has worked to support children through a transition from program to program, or from classroom to classroom within a program? What are some of the supports that you have put in place to smooth transitions? So we're going to put you back in your breakout groups and give you about 6 minutes to talk about things that have worked for you.
Okay, the rooms are open.
We'll give people a couple more seconds to rejoin. We had a great conversation in our group about many transition activities that have worked well, and I think these and many more kind of came up and were covered. And Anne, I just wanted to do a check. We just have like 2 minutes left. Is that right?
We do. Thank you.
Okay. Well, so much for questions at the end, y'all. Sorry about that. But yeah, these are some of the ideas that we talked about, just being able to make sure children get to say proper goodbyes when it's time to leave friends. We talked, there was great conversation in our group about helping children learn what a new environment is going to be like, a social story, pictures, a visit. So all those things that we do to help children know what to expect. So I hope y'all got to have some great conversation about those things as well. I'll just share a resource as we wrap up here. We have found it really important in Arkansas to help cut through some of the myths and communication problems between child welfare and early care and education. We developed a partnership toolkit with cooperation from the state agencies. So it's not so much important like as much what's in the toolkit as the cover letter that says from the head of child welfare and the head of early care and education, y'all got to be talking to each other. And we can share information to serve a child better. Caregivers need information, to provide the best quality of care, and we can share it. And there's certain pieces that are confidential, but many things that are not. And this toolkit includes ideas for appropriate information sharing. So if that's a conversation that's helpful to start, in your agency or in your, system, then that's freely downloadable. And so
is that included in the handouts or downloadable from your website, or?
It is downloadable from our UAMS website. So
Okay.
if you Google like Project Play, children in foster care or something like that, you ought to find it pretty easily. But the link is also on the slides here. So
Okay.
Hopefully you can be able to grab those from the conference website. So that's all we have time for today. And sorry to cut short the question and answer time, and really enjoyed our time together today. Thanks for being with me.
Nikki, if this is Beth from Georgetown, if I only had one question that I saw, can they email you if they have questions about things?
They can email me, and I will put my email in the chat if it will somehow. There we go.
Because we had a question about data, about child removal and race and things like that. So Miriam had asked that question. If you want to email Nikki, if she might have that, or she might have that on her website at University of Arkansas Medical Center School.
Sciences,
Sciences, sorry.
So, and I put my email in the chat, but it's naedge@uams.edu.
All right, well, thank you all very much. And this will be available as a recording in 2 weeks on the website for those who may want to share this with other folks. And we really appreciate your time, Nikki, in presenting this to us. Thank you.
Great to see you all.